I think Texas A&M, we should start with howdy.
Howdy.
Okay. Are you familiar with this? We always did howdy in the beginning of it, yeah. I don't do that. But anyways, howdy or gig'em, I think those two words, right? Yeah, thank you so much. I'm so excited to have this keynote speaker today. I was asked to make his introduction very, very short. You know, I can read his bio for a long time, but we have a very, very interesting presentation content, so I'm gonna make very, very short introduction. Mr. Todd Frazier is a long title, General H. Dobbin, MD, Presidential Distinguished Centennial Director in the Art of Medicine at Houston Methodist Hospital's System Center for Performing Arts Medicine. So it's known for CPAM. He's a director for that. It's an amazing facility and people I met last year, and I was like, I'm gonna invite him. You know, so hopefully we can make a great connection and then learn from his work. Thank you so much.
Oh, good. Thank you. And more importantly, I have a long connection to A&M. My grandfather graduated in 1919, and every generation has had some connection. More recently with, Tarleton State in Stephenville, where my family is from. So I'm happy to be here to share what we're doing at Houston Methodist. The presentation has a lot of visuals and videos with sound. The idea is that I really wanted to take you into the hospital and show you as firsthand as you can get how the arts are being integrated on a daily basis, both in community areas and overall patient-employee experience and engagement, as well as in the clinical areas. And so what I usually start out with is often these centers are influenced by where they are. And as many of you know, Houston's a very large city. In the background is our downtown, and in the foreground is the Texas Medical Center. As many of you may know, it is the largest medical center in the world. And I've been recently told you can cut it into quarters, and each quarter would still be the largest medical center in the world. And I don't say this a lot of places out of Texas because they'll start rolling their eye. What? Oh, did I say something? Oh, they'll roll their eyes, because we're always talking about how big things are in Texas. But I only share that because I think for us it's created what I call it a healthy competition amongst the member hospital institutions in the Texas Medical Center, and encourages each one to think of how they can distinguish themselves uniquely, and it encourages innovation. We also have a very strong arts community, arts and culture community with many universities, small, mid-sized arts organizations, and all the major theater district organizations, the Symphony, Ballet, Opera, Theater, and Museum District. So this set up a very nice relationship between the arts and medical community. We actually started this center 30 years ago next year. So 2026 will be our 30th anniversary. It started as a sister center to sports medicine. So in fact, we have and we still manage a clinic in which if a singer has a vocal cord issue or a dancer has an ankle issue, they would be triaged to the Center for Performing Arts Medicine. That's kind of where our name came from. And they would be set up with the right physician or therapist that understood what their injury was and how they needed to get back on their feet, as opposed to a tennis player's wrist, or a football player's ankle would go to sports medicine. The hospital really understood this. This is just folded into a model that they already use for sports medicine. That really helped establish an anchor for us to then build on later our other divisions, which include how we're integrating the arts into the hospital environment, which I feel like is sort of building more of a two-way bridge and not just sort of helping the artists go back out and do what they do in a healthy way, but also bringing them back in. How we're using the creative arts therapies in more of the clinical areas to impact patient outcomes, how we're using modern assessment tools, especially like the fMRI, to look at how we can harness the potential of the arts in care, as well as thinking about the communities that we serve, the health of our general communities in and around our hospitals. So these are too many divisions really to go over today, and I decided I might focus more on how we're integrating the arts into the environment, and then the creative arts therapy part, and a little bit about how we're expanding to create partnerships to support arts in community health. Just a little overview of our center. We did see about 570 artists, are people who associated themselves more with the arts and culture communities with their particular injury than let's say the sports medicine. We touched almost 90,000 either employees or visitors in the hospital, patients with our arts integration programming. Our creative arts therapy presented nearly 12,500 sessions. And we have quite a number of research projects going on, most of them being very translational, because I feel as though we're able to use the results of our research right away to improve our therapy. And some interesting more recent relationships within the community, a university relationship with U of H, a growing one actually with A&M, we'll talk a little bit about, and some community centers and health clinics in the community in which we're sharing the arts. So I'll move into it. As I mentioned, real quickly on the artist health side, we're really proud of the hospital approaching it very much like sports medicine. In fact, if you go to the Houston Ballet, Houston Grand Opera, or the Symphony, you'll see the Houston Methodist CPAM logo, official healthcare providers. So the hospital's actually really seen value in marketing toward not just artists, but the arts community, the philanthropic side of the arts community, the people that attend the arts as good eyes to have on a quality healthcare brand. Artists can receive a free artist card, which you see there, which registers you in the system so that anytime you might come to Methodist, there's a flag that comes up that shows that you are an artist, and if there's a difficult medical decision to be made, for example, the difference between intubation and a tracheotomy, let's say for someone who uses their embouchure, or someone who wants to not risk paralyzing a vocal cord. We've had those decisions made by our ENT before. That's really helped patients. But like I said today, I'm going to move more into our arts integration. So this is a slide that just kind of shows you the different ways that we find, I like to call them entry points along the patient experience, that the arts can provide value over a journey. You'll see we also collaborate with food and nutrition services for activities on their food trays, with volunteer services, with art carts. We have lots of digital programs. We have artists in residence programs, and we have a TV channel that we manage content for 24 hours a day. And this will lead to our first video. This is actually something we produced, and we thought, wouldn't it be interesting to follow a patient from the time they got out of their car to the time they were discharged, and just sort of observe the different ways the arts had impacted their journey. So hopefully this will all work well, and if you can't hear me or anything, or volume up, just raise your hand. Let me see, where am I?
The Center for Performing Arts Medicine at Houston Methodist, more commonly known as CPAM, integrates the arts into the patient, family, visitor, and employee experience. The first thing a patient experiences at Houston Methodist is one of our beautiful lobbies. While entering the building, guests are welcomed by live music, offered 7 days a week in the community lobby by staff and volunteer pianists. The pianists are trained to provide music in response to the mood of the space and create a healing environment through their music. In addition to these resident artists, weekly special performances by visiting artists range from internationally acclaimed performers to local school and volunteer groups. The amount of live music offered makes the hospital one of Houston's most active concert venues. After evaluation with a Houston Methodist physician, or while waiting for a procedure, guests may turn to the CPAM channel on the television in waiting areas and inpatient rooms to watch specifically created arts programming. Live paintings of nearby seascapes or musical performances recorded outdoors allow guests the opportunity to see the arts in unexpected, beautiful arenas. Traveling throughout Houston Methodists, guests and patients are welcome to enjoy the artwork adorning the hallways. CPAM has curated a Houston Methodist Hospital campus art walking tour in partnership with the Wellness Department. The tour highlights artwork across the campus. Beyond the aesthetic value, the art tour encourages visitors to be active during their time at the hospital. One stop on the walking tour showcases Houston Methodist's ongoing commitment to the arts with this mosaic entitled Arms of Christ. The outstretched arms of Jesus Christ are flanked by images from the history of medicine, including Hippocrates, the father of Western medicine, nursing pioneer Florence Nightingale, and medical advancements through the middle of the 20th century. Back inside the patient room, patients are offered art activities in partnership with food and nutrition services. The activities are delivered on lunch trays and invite participants to engage with the arts at the convenience of their bedside. The activities range from creative writing to origami to music listening and more. This allows patients to express themselves creatively while reflecting upon meaningful aspects of their experience in the hospital. Additionally, CPAM offers art carts that provide creative activities like watercoloring to patients. Using artistic resources can allow patients to pass the time and focus on something other than their illness. During rehabilitation sessions after a procedure, music therapy is part of the treatment team. The music therapy department at Houston Methodist is one of the most diverse and comprehensive departments in the nation. Patients are also provided a patient empowerment iPad for convenient, on-demand access to CPAM interactive programming. Whether reflecting on their unique experience through creative writing, tuning into a live performance at the hospital, or engaging in visual arts programs, the iPad offers broad arts access. When a patient is ready to prepare for discharge, a visit to a live music performance in one of the lobbies with their therapist offers unique and rewarding support to their journey. Today's performance features Ermelinda Cuellar Trio, a jazz ensemble that visits the hospital regularly. A therapist, nurse, or family member may use the concert as an opportunity to escape the routine of the hospital, lower anxiety, and offer rejuvenation. Upon a patient's return to their room, they may see employee artwork used as a creative response to hospital needs. The photographs allow employees to connect with their patients and visitors on a more personal level. Then, just as the journey began, the last thing a patient remembers when leaving surrounded by art and music is the unique care they received from Houston Methodist.
So since then, we've added something with volunteer services, the Pick Your Art piece. So we have a way for them to choose amongst a variety of employee photographs to be put in their rooms. So they have some say of what their room looks like. We also, as I mentioned, have now several creative artists in residence in creative writing, visual art, and music. We just grabbed this little video to so the harpist and pianists have adapted to learn all sorts of literature they didn't know before, including country music and folk things, and they've just had a wonderful time. We tend to use this on the longer term care, what we call continuing care. Patients are in inpatient rehab for weeks and sometimes months and really experience a lot of isolation. Probably maybe not a surprise to you, but it's always somewhat of a surprise to me how much this also has helped the employees. The employees on those units being able to refer patients to the artists in residence, because oftentimes they know that they're sort of suffering and they're not having family visitors, and there's a feeling that they want to do something to care for them. We've had a very, overall, the way we engage with our patients, we have our own internal surveys, and one thing I recommend in working in a hospital is sort of not only to evaluate sort of the musical experience itself, but we always include some questions which also occur on our third-party government patient experience survey, which some of you may know by the acronym HCAHPS. It's a healthcare survey that any hospital using Medicare or Medicaid has sent to its employees. And it's a very valuable survey for hospitals because the higher you score on this survey, the higher your percentage of reimbursement and percentage for purchasing discounts is. So we've really locked on to this as a key indicator that translates value to the executives at the hospital. So we'll always include a few questions from that survey on our own surveys, and one general one is how did this experience, impact your impression of the hospital. So it doesn't say something specifically about the arts, but certainly gets into maybe how it impacted their experience. You can also do keyword searches with these government surveys that your hospital receives, and we started searching for things like piano, violin, music therapy, things like that, and we started to find that we got some hits, which had kind of surprised the HCAP office. They had just not looked for those things before. It also helped us do a better job. Every now and then, just because you get a hit doesn't necessarily mean it's positive. It could be something like something was too loud. And that's really adjusted what we program, how we program, and when we program. So we're happy that we're getting a very, very high rating of positive remarks. We've also thought about where our hospitals are. Our hospitals closer to Louisiana and Baytown, we realized they weren't using the word violin, they were using the word fiddle. So we have all these sort of colloquial names for what they may have said. And we can even now dive very deep into very specific questions. How likely would you be to recommend this facility to your family and friends? That's a really important question on these HCAHPS. Now, some of this may be new information to you, or you wonder sort of why we're drilling down so hard on these questions and they don't even ask about the arts. Well, the responses to these questions tend to be what these patients remember and how they felt about their experience. And you would think, they would probably talk about their doctor and how well they did with their doctor. But when you start to really look at your experience in the hospital, you only see your doctor for a very, very short time usually. And it's what, a lot of times the nurses are mentioned, but things that they remember about their experience and reflect well on what we do. So we've really been able to drill down and show the hospital that these experiences through the arts very much positively impact their patient experience scores. Now I'll move into the employee area now. So the employees, as I mentioned, we didn't realize the impact we had on our employees as well. So sometimes I feel like we're doing as much for our employees as we are for the patients. We have what I call HR benefits. These are classes almost every day employees can sign up for. These are employees, volunteers, and students. So some of the A&M InMed students that come to campus, they've participated in these as well. Anything from creative writing, photography, museum tours. We have an employee choir. But there's an underlying goal to all of these programmings, and that's why our HR department has been very supportive of us. And the underlying goal is to try to build resiliency and to try to ultimately reduce burnout in a healthcare environment where there is a high burnout rate. So let's say we go to the Museum of Fine Arts. We won't just pick pieces at random to look at and discuss and analyze. They'll all have some underlying connection to things associated with resiliency. The word resiliency, compassion, respect, boundaries, expression, things that might give the employees new ways to think about what they do, new ways to talk about what they do, and hopefully new ways to provide more resources. We have a new program which has kind of expanded our breadth just a little bit into the world of compassionate communication, which can include humor and can include a lot of other ways in conversing to look at how you could make a challenging discussion or a challenging interface with a patient or colleague, turn that into a more positive one where they remember how compassionate and empathetic we were. And so this one specifically, we have had a few of the A&M InMed students, as well as students from different programs we have relationships with. The built environment impacts the patients, but we usually try to engage the employees to help create the built environment. One program is called our Bloom program, which beautifies, even sort of turns into greenhouses, bridges across our different towers. And at all the nursing stations, the nurses would draw their country's flowers. So there were, bluebonnets, of course, for Texas, but they were flowers from all over the world, and they got to sign their names, and it ended up being a wonderful thing to beautify a bridge, but also the employees to feel proud about what they contributed to that bridge. Furthermore, employee photographs and the clinical team's sort of key words that they wanted to convey have beautified this inpatient rehab hallway where a lot of therapy also takes place. And as many organizations, we had to think creatively during COVID to try to do more sort of community art projects that rewarded and could employees, and where employees could remember what they'd gone through. And so this was a particular art approach which had a visual design of our building and all the different professions that went into the building. But as you look closer on your right, you can see the people who had made through the first year of COVID. It's all created by their names. So their names were actually created, the visual piece. In the beginning of COVID, we needed to do something to support employees. We turned all the break rooms into serenity rooms, which you can kind of see. They could adopt a plant. They could participate in some artwork. They had that's me in that massage chair taking a whirl. But as some of you remember, as COVID went on, we talk about sort of the second stream and that kind of thing. They said the serenity room just isn't working anymore. We need to let off some steam. And we thought, well, we could get in trouble for this, but there is a tie into a type of artwork called abstract expressionism that we could explore. So we turned those same break rooms, then serenity rooms, now into splatter paint tents. And we actually have created a sort of a model of how you do this in a hospital, how you protect the walls, how you gown up the different music, which of course went from relaxing music all the way to heavy metal, the different paint balls and splatter things you can use. And I was really worried about it because I was like, God, I could really get in trouble for this. Seems like really kind of pushing the envelope. And they would all come out sweaty, and they were laughing, and it really went well. They loved it, and it did what it's supposed to do. And I said, and in a way, they had fun and they splattered and they threw this, but it is some sort of artistic representation of what they were feeling. And so in the end, we took a collage from a lot of the pieces, and we put it and we framed it, and we had, after COVID, kind of a dedication of what the unit went through. They just had a very simple, when they walked in, they put a dot how they were feeling, and when they were walking out, they put a dot right when they walked out, just to kind of say, okay, are we on the right track, or is this backfiring? So in the employees classes, we do the same thing. There's the employee engagement survey by a third party in a hospital is a very important rating for the hospital now, and especially a hospital like Methodist that puts a lot of resources into their employees so that their employees can, of course, put their best foot forward for their patients. So a lot of the questions we ask in our evaluations tie into those resiliency questions like compassion fatigue, cognitive awareness, engagement, and those kinds of things. We also did a drill down. We have what we call frequent flyers. We have people who have attended 2 or more of our arts programming activities a quarter. We call them frequent flyers, and we can drill down and say, did those frequent flyers score better on those employee engagement questions than those who have not participated? And this was really exciting to see. Again, for some of you, let's say your students, you may wonder why I am bringing some of these internal surveys to light, because I think this field of arts and health has started to find ways to demonstrate value of what it contributes to a health environment, and demonstrate values in ways that are common denominators that all other clinics and all other centers are also using to demonstrate value. And I think that shows a good evolution of a field. And the employees are saying the things that we hope they'd say. The piano player in the lobby, my ability to contribute as a photographer, the opportunities that it created. So I'm going to move what I like to say is a little closer to the clinical side, closer to the patient treatment area with our creative arts therapy, which we have music and visual art. And we have someone here that trained with us, didn't we? Don't we? Here she is. Really glad to see that. We have focused on placing therapists who might have, especially who might have specialties in a particular unit, an ICU or a particular wing of a unit, a cancer center, let's say, infusion, inpatient rehab, inpatient psychiatric clinic, so they can really join a focused team and spend their time working on the patients who can best benefit from their care. So what I'd like to do now is take you a few videos that are our therapists treating patients, and of course we have permission from all the patients to use these. So I think in general, some of you may know what music therapy looks like in the hospital. A lot of people who love the arts resonate with that word therapy, or artist therapy, or music therapy. And they say, well, yeah, it is, sure it is. But I think it's a little bit rare to actually see what it looks like in a medical setting. So that's why I've created a few, we've created our own videos. So I'll start with, the music therapy spans the spectrum of care. It's all the way from very much mood motivation, mood oriented, through composed music and how you can resonate with that, all the way to the stimulating impact of rhythm and things that may not even look like music or anything through composed, but might have a very specific stimulating or motivational effect that might be used more in neuro rehab. So I'll start with inpatient psychiatric clinic, and every one of our patients develops a 7-song mood modulation playlist, and their first song is meant to match their particular trigger or anxiety state. And in the music therapy world, there's a term called entrainment, and it's sometimes interesting if we just had music come on right now, with a strong beat. A lot of us, without even knowing, would kind of start moving a little bit, and it's part of that distraction. Part of it is to refocus and distract with something that might meet rhythmically, harmonically, emotionally that particular anxiety or triggered phase. So the first song might be something you wouldn't expect to be therapeutic, but would connect to someone and refocus them. And then by each song that comes down, by using entrainment, having the rhythm maybe be a little slower, the chord progression slower, maybe at a certain point, motivational words, a song that they may write with their therapist, down to that 7th song, which the goal is, if they participate and focus on this, kind of like a guided meditation, they'll get back to their desired state. And so in the psychiatric clinic, you're not allowed to have your cell phone or anything. So when someone's feeling anxious, in most clinics, usually what they do is they go and they ask for what we call PRN medication. It means some additional medication just to sort of help them. And unfortunately, in most inpatient psychiatric clinics, that's one of the only solutions at that point. So we've offered another solution. They can go into the community area, and we have a directional speaker, and they can press their icon of their list, and while they're getting their medication, they can listen to their list. And what ended up happening is so much of the time when the patient finished their list, they just went back to their room or went to their next class, and they just forgot about the medication because they didn't need it anymore. So we said, wow, this is something interesting. Let's track how many times that happens and how much pharmaceutical dollar amount that we saved. Anyway, my challenge on these talks is that every one of these slides has a story like that, and I want to get through them all, so I'm going to move forward a little bit. This is what it looks like when someone comes and asks for medication.
Hey, excuse me, I'm feeling a little anxious. Can I get my meds, please?
I'd love to help you, but have you tried using your music listening playlist yet?
Not yet. That's a good idea. Let me go and do that.
Why don't you give it a try and
Thank
let
you.
me know?
Okay.
Thanks.
Come to the music listening station, right over here. Have a seat. And your playlist is number 1. Go ahead and press play.
Okay, remember what I said about music starting, and watch his foot. So that's just a little sign that there's something happening. There's a distraction there. I will tell you, the nurse looked nervous because we're filming today, and she was so nervous, and she had all this makeup on. She usually doesn't wear a bunch of makeup, but it was fun. She was excited. Again, we do a very simple pre and post, really not to take much time. A red would be to have a negative response. So everything has been in the green. The lists are working well. I thought, I said, this is great. We're going to save like hundreds of thousands of dollars of medication. But it ends up that this PRN medication that they use in psychiatric clinic is really, really cheap. So we did have a lot of savings of medication, but it really wasn't that huge dollar amount. But the bigger win was we downloaded these lists onto their phones when they're discharged. And so a lot of the patients, through their social workers, had communicated that they were using it. They would use it in the grocery store. Sometimes a parent would say, you might want to try your listening list. Or there's some tool they can have without sort of forgetting their medication or having to buy medication. And so we tracked some of the chronic users through the social workers, and many of them cut down on their readmission. There's a high readmission in these clinics. But we were excited to realize that there's a tool that we could leave them that could provide them some value. And you go back maybe 20, 25 years, and you might look at someone strangely in a grocery store with a headset in a corner with a phone. Now everyone has that, and so there's no, they didn't feel weird about it or anything like that. So that's a valuable part. And we also we connect with artists in the community. The Houston Grand Opera is compelled by what we're doing with music in the psychiatric clinic. So a group session of music therapy in the psychiatric clinic might look like a lyric replacement project, where you might find a song that has a lot of words that are compelling words to kind of analyze, and you might make it your own, or the group might make it their own by replacing words. And the neat thing is then the Houston Grand Opera singers will sing the new song that reflects the session, what came out of the session. And that's been a really wonderful way to also bring in the community artists. We've had very good success on these music therapy group sessions. In particular, the graph on the right shows a very significant reduction in a de-escalation of mood settings, and so we've been very well supported with integrating this new application into that setting. And unfortunately, before we were there seems to be there doesn't seem to be a lot of resources in some of these inpatient psychiatric clinics. Some people just tell me it's either it's medication or restrainment sometimes, and then there's therapy classes, but you don't have to go. You're supposed to go. So we just thought, that's just not good enough. I mean, some people might resonate more with these programming. So we're really happy we did that there. I'm going to move more now into our rehab area, and I've got 2 or 3 videos that show you different ways music is used. This one is very much, it can be a metronome. It's much more of a rhythmic stimulation, how rhythm can coordinate efficiently coordinate the nervous system. And this is a stroke patient relearning how to walk. Although there is a chord progression here, and when possible, they'll do rhythm with a chord progression of a song that the patient might know. So there's always that opportunity for something motivational, and especially, musical memory is a very strong thing that we all have. And so when you can combine the two, that's nice. So this is a video of what we call a gait therapy training session. So it isn't always that they're stepping to the rhythm, but it's how the rhythmic aspect can organize time and stimulate the nervous system in an efficient way. And the reason it helps in this is the gait becomes a little more natural, and so those muscles are being used and stretched in a more of a natural way. And this very often equates to a quicker time to what we call a step down unit. This is an example of a stroke patient that has a common experience of understanding what you're saying, wanting to articulate speech in a normal way in English, but not able to get the word out. So in this one, we have more information through the fMRI. There's some damage to the frontal left lobe, which is affecting that approach to articulating speech. The frontal right lobe, as we've seen, is a secondary support to speech, but more of a rhythmic and melodic side of speech. So in tapping the left hand, the thought is that you're priming the frontal right lobe, and then approaching speech through melody often can confirm that that's an area of the brain that you can work with therapeutically and approach speech, and over time can become a primary area for speech. So the patient's wife would propose a song. In this case, it's Amazing Grace, that he would know the words to and the melody to if he could sing. And so you can see how it plays out. Whoops. Let's see here. No, it's, how do I get it to play? Oh.
Can you ask me that? You try to say, how are you? Okay. All right. And if you're feeling tired and you want to go back to bed, Good, really good. I am in pain. That's it, so tap with me. I am in pain. I am in pain. So, if like yesterday, when you start having those spasms, you start having that, your nurse comes in, you can tell her. Great.
So that's a pretty compelling example. What we also do is we have days, what we call community reintegration days in the inpatient rehab, where they sort of just are getting ready to be discharged, but they learn how to get dressed and navigate to a certain area of the hospital. And in this place, they go to a concert. But their therapists come with them, and they oftentimes continue their therapy, balance therapy or movement therapy or gait therapy. It's hard to get videos of these things, but we think it's really sort of a beautiful thing to just see. And the public attends these concerts too. Again, maybe a little risky. The patients sign a release, and we didn't want them to be uncomfortable. It's time for their families to come, and it's a beautiful intersection of, I think, arts and health. Darn it. Let's see. There. So I'm going to move to another area of, where are we? On the NICU. And we have a full-time music therapist in the neonatal intensive care, and we work a lot with the recorded sound of the mother's heartbeat, the sound in the womb, paired with the mother's voice or a lullaby or a song. And so this to sort of reduce anxiety, to provide stability for the baby. There's also something called a pacifier-assisted lullaby, a lullaby device, which we've really enjoyed using. And it's a pacifier that if you do a certain number of sucks, it rewards you with that wonderful sound of your mother's womb and heartbeat, and then the lullaby. And you can adjust it, so the first suck, you get the sound, and then they stop sucking, and then the nurses sort of know how to push it just a little bit, and they'll suck 2 more. You can adjust it to do, the reward comes with 2 sucks. And then they'll suck once, and they'll frustrated, they're real cute, and you kind of push it. They kind of learn, and 3 or 4 sucks, 5 sucks. And so goal is developing the strength to feed on your own, and that then can really help gain weight. And I want to show you, we do this in our NICU, but these are some colleagues that have let me use some of their videos.
Researchers at UCLA Mattel Children's Hospital are studying a device called Pacifier Activated Lullaby, or PAL. It plays a lullaby written and sung by the baby's parents when they successfully suck on the pacifier.
They love it, especially when they hear their parents' voices. They want to keep performing.
This is critically important for preemies born before 34 weeks who often struggle to feed because they haven't developed the reflex to suck, breathe, and swallow.
Sometimes that's that final thing that needs to happen before an infant is discharged from the hospital, is their ability to feed orally with strength and endurance.
70% of preemies improved their proficiency using a pacifier when the PAL device was used, a skill that's important for feeding.
She's doing it in rounds of 6.
Oh wow, yes. In hopes to shorten hospital stays while also empowering parents and easing their own emotional distress while their babies are in intensive care. With the help of the PAL device, all 3 of the triplets fed better and grew stronger.
Doing great.
And were able to go home together at 52 days old.
Hi, baby.
Now they are healthy babies growing by the day.
So that's, we've found similar success in moving, this would be the heart rate, moving it into an average heart rate. And the good thing about this is the green is 5 minutes after the intervention, sort of still in the normal heart rate. The one we were really excited about and actually had to do twice because the increase was so dramatic. Although the babies are so little, you know, maybe it does make sense if they're able to strengthen their sucking power, and then they're really able to gain the weight that they need. That we've really had success in weight gain, which again, thinking there's all sorts of clear values in this, but in the hospital as well, once they can feed on their own, they go to what we call a step-down unit, and that's a big win, and that's a big plus for the hospital. So to summarize, we use these HCAPs, these government surveys, to sort of track our value in the hospital, how well we're doing, and that's a really great way to communicate value to our leadership when our center is reviewed, because we're a non-billable center, which isn't unique for a hospital. There are other centers that are non-billable, but you do need and you want to demonstrate the value that you're bringing to the hospital. The employee engagement scores, those same ways, and then any of our own surveys integrating these predictive questions at how the employees or the patients might fill out their third-party surveys. Those are much more powerful internal surveys. And now all of our creative arts therapists are working on this Epic medical system. So it's all based on referrals. And we've created our own music therapy chart to look at pharmaceuticals, length of stay, and readmissions, and all the different sort of marks that we know equate to value to the hospital. So I'll finish with a little bit on what we're doing on our education and outreach. What I like to call this field the field of arts and health, and it doesn't just happen in the hospital. It happens in community settings and in all sorts of settings, in school settings. We have our hands full with what we're doing in the hospital, but we do care about the health of our community and what's happening in and around our communities. So we've really reached out to partners, and one of our partners has become the University of Houston, in which we've helped them roll out what's called an Arts and Health Certificate, which anyone in the fine arts can do an extra 4 hours, and they take classes, most of them with us in our hospitals, to learn about how you would approach arts in a health setting and the purpose of the arts in a health setting, which is sort of a jump from someone who hasn't really sort of thought about that. They have really embraced the clinical side of it, so they've started a music therapy degree. We're proud that the director of their music therapy program has a joint appointment in the medical school and the fine arts school, and is really providing a bridge to those students. And those degrees require a certain number of hours, I think 1,000 hours of you did this, right? Of internship and placed in a hospital. So being in the Texas Medical Center, of course, that's a big resource where you have a lot of the hospitals, to work. We also have been asked by the Red Cross and by some other organizations to visit areas of the community that have been suffering. Unfortunately, there was a school shooting at the Santa Fe High School. We have had several devastating hurricanes where people have had to be housed in different areas. And so we have kind of teamed up, almost felt like, you know, they're your traditional ambulances, but we sort of have an arts and health ambulance. You know, we need to be dispatched to a certain area that's experiencing stress and set up a triage area, and how can we use the arts to help the families, the children, the people in the communities. So we actually built one. So this is our arts and health van, and the mural was commissioned by a local artist, and it's an intersection of arts and health themes. We have a stage that comes out, and we have posters that have QR codes that link to all sorts of arts and health resources, as well as resources to community health clinics, with the idea that we really want to try to help people be matched to a health home, and to do preventative work as well as, community health work. And so we'll bring the van out to a variety of festivals and different things. You may have heard something called the Art Car Parade that happens in Houston. Anyway, this was part of the Art Car. I put the QR code there because that's the same QR code we use on our poster. I don't know if it's working for you. It is? That's how we feel like we're really trying to help. And we got a CDC grant to do this, Center for Disease Control, through the arts to share health information. So this is something, so it's a lot of fun. And although we need partners, we need university partners, we need artists, we need arts organizations to meet us halfway and build this bridge into communities. I guess I feel like this is the next big growth maybe in the world of arts and health, is community arts and health. And so this could be something we could do with A&M if you had an interest in this. Certainly the van could travel. In general, there are some good resources on the National Organization for Arts and Health website. These are all free downloads. In fact, this particular booklet, Arts, Health, and Wellbeing in America, I use this as a syllabus, just straight as it is for an Introduction to Arts and Health course that I taught at U of H. It has concise definitions, good examples, and so that's something that can really be a resource for you. As you might imagine, it's hard for me to do presentations like this in an hour because there's so much more that I would want to show you. But all of the videos that you've seen today and more are on our website. And there's a section of our website that I like to call our educational video portal. And that's where all of these websites, all of these videos exist. Partly because we had a hard time finding just on the general internet good quality videos with good sound and just of some of these things. So we said, well, we'll just make our own, and then we can share them for people to help promote the field. So I had been asked to end a little bit early, and I can't believe I did. I think we have 8 minutes, but I wanted to do so just in case there were any questions, but I do appreciate you asking me to share the presentation today, and I hope it's been interesting and inspiring to you to see the breadth of how the arts have been integrated, at least into one hospital in Houston. And we love A&M. We already have an academic partnership with A&M, and if there's anything we can do to further your interest in bridging the world of arts and health, we'd sure be happy to work with you. Thank you.
Maybe a few questions before lunch? Remy?
So I have 2 questions. One would be, how are you able to resolve this debate about one of the reasons healthcare is getting very expensive in the US is how large our hospitals are and the cost of maintaining those buildings and all these additional add-ons that we are having that is driving the cost of healthcare up in the US. I was listening to a documentary on TV a while ago, and the person is actually an American that traveled to Europe to get a procedure done, and the cost of the procedure was even less than is out of pocket if you were to do it in the US. And he got into the hospital, and it's one small clinic that had everything that needed to be done. And we just walked in, and he was so surprised that, are you sure this is an hospital? And they said, yeah, this is how our hospital is. And he is used to an hospital that looked like a hotel. And he walked in, did his procedure, and that's it. And it was less than what it could have been if he had done it in the US. And one of the things it could connect is because the hospitals in the US have too much add-ons and it's driving the cost of care up because they have to spread the cost over everybody. So how are you able to navigate that with this program? The second question would be, I've seen that heart and health is very successful in ambulatory care, but how can we translate that into students' care? How can we help a student with heart and well-being with their busy schedule and still be able to go to class, be able to do everything as a student, and still be able to use those resources to be resilient?
Well, you might have the theme for your next conference. I mean, that's a big question. I will tell you in general, hospitals are concerned. The concern comes from uncertainty, because there's uncertainty as to how lowering of the cost of pharmaceuticals is going to impact reimbursement from insurance, how changes in Medicare, Medicaid are going to affect reimbursements, because you're right, some hospitals like Methodist run the infusion wing, all day long, every day for people needing to come for their infusions. And the reimbursement of those pharmaceuticals also does cover a lot of ancillary support that those patients have while they're waiting, all the way from spiritual care, patient experience, just the setting in which they're waiting to try to sort of ethically, help people through pain. And some of it might even go to translational research, that sort of helps. So you're right in to say that many American hospitals have enjoyed a certain level of reimbursement that can help other supportive areas, which can be good, but there are nonprofit hospitals, there are nonprofit faith-based hospitals in America, and there are for-profit hospitals, and each of them are reacting a little differently to the uncertainty. I like to try to do what I say, elevate the conversation, because some of the first things that people are, let's say, at administration of a hospital will say, well, this looks great, but who's going to pay for it? And so we are lucky in a way. Houston, Texas, and some of the major cities, I think, will be somewhat resilient and fairly independent because we have such good philanthropy. In Houston, you ask the mayor, what are the key highlights of the city? And he said this. He said, well, it's healthcare, the arts, and oil and gas. And I said, well, you put those three together, you can sort of fund each other and help rise all ships. So what we usually do when we want to initiate a program is we find philanthropy, a grant or some philanthropy, knowing that it can't sustain it long term, but it can test an idea. But it does more than test the idea. It elevates the conversation then to, oh, so I don't have to worry about who's paying for it, at least right now. Let's see if it helps support what would be an elevated goal of care. So like our very first music therapist was in the inpatient rehab, and it does the gait training and the speech. So once we got them in there for 4 months philanthropically, and they coordinated with the team, and they showed they had all of these resources to bring to the team didn't want to do without it anymore. And now you can say, now how can we talk to each other about working together to figure out a way to keep this added resource? Because now I can see overall, people are going to want to choose this hospital because we have that resource. People that had this experience are going to be motivated to support the hospital. There's a whole nother level of larger scale benefit. It's very hard to get there with a very first question of who's going to pay for it. So it takes work, it takes creativity. It's why I've spent time with some of these slides just sharing information that we've found that does speak to the bottom line. Does speak to us. I skipped one of the slides just for time, but it was for how impactful. Maybe you remember this. music therapy assisted vent weaning was for lung transplant. And it's been so successful because they realize it's the only service that actually works with and for the patient, spends time. Why are they anxious? What are they going through? What are they thinking about? Do they have a relationship to music? Can we use music to sort of stabilize your respiratory rate, get you in an ideal environment, combat that fight or flight. That's why you've been failing your vent weaning. And they come in and do the vent weaning, and they can't believe they just pulled it right out, and the lungs, because they've been strengthening the lungs too. And then immediately our director of critical care throughout the whole system wrote in Epic, said, I require music therapy assistance for every vent weaning in our system. And that completely elevated the conversation. Now, we couldn't possibly do that. I don't know if you remember that. It was a great thumbs up, but we said, look, let's compromise, because we'll say after one failed vent weaning, then you request music therapy, because then it gets much more serious as you're failing those vent weanings. And I found out that's one of the most expensive things that a hospital pays for, these ECMO things, these vents. I think the trouble with some hospitals where they're maybe contracting services, or even if they're using a university maybe to support certain services, they don't have, the luckiest thing about our center is it was started as an institutional service line of the hospital. So I'm in all the director meetings with orthopedics, with mental health, and we're right there in the middle, working internally, trying to make change. And that has helped us, has benefited us. But all your questions are relevant. I think it may take a long time, to answer all of them. But I do feel as though the data is compiling, and in fact, there'll be a change at some point where we see that actually this replaces enough pharmaceutical, this replaces enough medical costs that it's actually a lower care solution in some cases. We're not quite there yet, but I hope we will be.
Okay, thank you so much. I think he's going to be around in the afternoon, so maybe we can have more conversation around if you're okay. Thank you so much. It was a great presentation.